All right, let's jump right in. We're going to talk about something that honestly impacts every single one of us, mental health. And we're going to cut through all the noise, all the confusing terms, and really get down to what it means to be mentally healthy. And, we have to start right here with this quote from the World Health Organization because it completely reframes everything. This isn't just some nice, fluffy sentiment. It's a core idea. It's telling us that mental health isn't an afterthought. It's not a nice to have. It's right up there, on the exact same level as our physical health. You just can't have one without the other. Okay, so here's the game plan for this explainer. We're going to start by redefining what mental health even is. Then, talk about how it's not a fixed thing. We'll get into some common disorders and the signs to look out for, and then, a big one, we'll tackle stigma and talk about the #1 way to fight back against it.
All right, first up, we've got to build a solid foundation here. Because for so long, whenever people talked about mental health, they were really just talking about mental illness. We're going to flip that completely on its head.
Just take a second and look at the language here. Notice it's all about what we can do. It's about knowing what you're capable of, handling the normal stresses that life just throws at you, being productive, and feeling like you're part of your community. See? True mental health is about thriving and having capability, not just about not being in a crisis.
Okay, so let's keep building on that idea. Because mental health, it's not some simple on or off switch. It's not just good or bad. It's way, way more complex than that.
Yeah, this really nails it. It's not a switch, it's a spectrum. It's like a sliding scale. Every single one of us is somewhere on this continuum. And where we are, well, that can change. It can shift from day to day, even hour to hour, just depending on what's going on in our lives.
So, what makes us move along that spectrum? Well, it's kind of like a tug of war. On one side, you have risk factors, things like poverty or violence or being bullied, that can pull you towards the unhealthy end of the spectrum. But on the other side, you've got protective factors, like having good emotional skills, positive relationships, a safe place to live, and these things build us up, they give us resilience, and they pull us back toward well-being.
But, sometimes those risk factors, they really start to pile up, and the challenges just get more serious. So let's talk about what happens when someone moves further down that spectrum into the territory of what we call mental health disorders. But before we do, I want you to really look at this number, 1 in 6. Think about that. Right now, at this very moment, 1 out of every 6 people is experiencing a common mental health disorder. This isn't some rare thing that happens to other people. No way. It is a fundamental part of the human experience, which is exactly why we need to understand it. So, to make this all a little less overwhelming, experts tend to group these disorders into a few main categories. You've got anxiety disorders, that's things like constant worry or panic. Then there are mood disorders, like depression, which really affect your emotional state for a long time. Psychotic disorders, like schizophrenia, can cause a sort of break from reality. And then eating disorders, which involve really harmful patterns around food and body image. Okay, enough with the clinical categories. Let's get really practical. How do you actually spot the warning signs that someone, or maybe even you, might be struggling? Because these things aren't always a big, dramatic event. A lot of the time, they're these subtle little shifts in everyday life.
Okay, let's run through a few big ones. First up, sleep. Any major change here is something to pay attention to. Whether it's not being able to sleep at all, or suddenly sleeping way too much, that can be a huge red flag.
And it's not just a coincidence. The link here is so strong. I mean, look at this. A whopping 90% of people with depression say they have issues with sleep. It's one of the clearest physical signs that something is going on mentally.
All right, next up is appetite. And it's a very similar story to sleep. A big, sudden shift in eating habits, eating way more or way less, can definitely be a sign that something deeper is at play. And of course, there's the one we probably think of first, changes in mood. But it's important to know this isn't just about feeling sad. It can show up as being irritable all the time, or just feeling numb. Or it could be these really dramatic mood swings. This next one is a really important behavioral sign, pulling away from people. When someone just starts isolating themselves, they stop hanging out with friends, they drop their hobbies, it's often a sign that they just don't have the energy or motivation to connect with the world anymore. And there are definitely others to watch for. Things like just struggling to get through a normal day, not being able to focus, feeling disconnected or numb, or even being super sensitive to things like light and sound. The key thing to remember is that these are real, noticeable changes in how someone is functioning.
So, this all leads to a massive question, right? If this stuff is so common and the signs are often right there in front of us, why is it still so unbelievably hard to talk about it?
No, seriously, just think about that for a second. We just established that 1 in 6 people is dealing with this right now. That's more common than a ton of physical conditions we have no problem talking about. So, what gives? What's the barrier?
The answer, in one word, is stigma. It's this huge wall that stops us, and it's built out of a few ugly things. Just not knowing enough, holding on to negative stereotypes, and a totally understandable fear of being judged or treated differently.
Okay, so if stigma's the problem, what's the solution? How do we start tearing down that wall? Well, the answer is actually simpler and way more powerful than you might guess.
And this, right here, is the proof. Check this out. It's from a study on what happens when people are actually educated about mental illness. Before the class, they tended to see it as embarrassing or incurable. But after, look at the shift. They saw it as way less embarrassing and, this is huge, as something that's actually treatable. Education literally took apart the stigma, piece by piece.
And that's really the main takeaway from all of this. Education, awareness, that's the antidote. The more we all learn about this stuff, the more we talk about it openly, the more that big, scary wall of stigma just starts to crumble. It makes the whole conversation normal, and that makes it so much easier for people to reach out and get help.
So I want to leave you with this final thought. We tend to picture mental health care as something that happens inside a doctor's office, right? But what if the first, most powerful step toward getting better isn't a treatment plan at all? What if it's just a conversation? A simple conversation started by someone like you, who just took a little time to understand.